Perrin, I'm Amber. I'm a student paramedic and I'm going to be looking after you today.
Hi.
So I'm here with Perrin this evening. Perrin is 34 years old. She's had a cold recently, so she's been off work sick. She spent most of this afternoon laying on the couch trying to recuperate. The phone in the kitchen has rung, so she has got up from a laying position in a hurry to go into the kitchen and answer the phone. When she stood up in a hurry, she's felt quite dizzy, quite woozy with a bit of blurry vision. She's then tripped and fallen heavily on her right knee. So we've obtained a full set of vitals upon our arrival, all of which were in normal ranges other than our blood pressure, which was 110/70 in her sitting position that we can see her in at the moment. Her blood pressure then dropped to 80/60 upon standing, which would be, in my opinion, indicative of possibly postural hypertension. We've ruled out possible seizures with her past medical history. She has no history of epilepsy or seizures. We've ruled out hypoglycemia with our blood glucose test, which was within normal ranges. And we've ruled out cardiac syncope with our unremarkable 12-lead ECG in our vitals as well, coupled with normal heart sounds on auscultation on our cardiac assessment and a normal strong pulse on palpation as well. So we're going to move to Perrin's knee now. So it's her right knee here that she's landed on quite heavily. So before we do anything, we're going to visually inspect Perrin's knee. So we're going to just check its general appearance, its colour. We're going to look for any obvious deformity, swelling, angulation, any squared off versus round, shaping of the joints, any bruising, redness, cuts, abrasions, things like that. So we can see with Perrin's knee here that there is a slight bit of swelling, but nothing too extreme, and a little bit of bruising on the medial side of the right knee here. So now that we have visually inspected Perrin's knee, we're going to gain permission and we're going to palpate the knee for crepitus, any localized tenderness, infection or enlarged lymph nodes. We're going to check pulses, capillary refills, and we're going to check for any pitting edema as well. So Perrin, is it okay if I just have a feel of your knee here? Yeah. If at any time it's too sore, you just let me know, okay, and I'll stop. Right. So first of all, we're just checking for any possible crepitus, so creaky sounding bones, things like that. Just some gentle palpation without causing too much pain. We're checking for localized tenderness. So Perrin, whereabouts is it most sore?
Yeah, most
through
on the
here,
inner side.
through here where that little bit of bruising and that,
Yeah.
and that little bit of swelling is? Okay. Anything around this side here?
Not really.
No? Okay. What about through your kneecap here?
No, not really.
Not too bad?
Yeah.
Okay, great. Okay, so I can't see any signs of enlarged lymph nodes or anything like that either. So we've got a normal cap refill, which is under 2 seconds. No sign of any pitting edema. And we're going to check for a normal distal pedal pulse, which is present. Okay, so after we palpate, we're going to move on to the integrity of the knee. Okay, so we're not going to move this knee until we can exclude a fracture. So Perrin, have you been able to weight bear on your knee at all? Have you been able to put any weight on it since you fell on it?
Yeah, I just as long as I'm kind of balancing on the couch or
so with
not full walking.
Okay, so with a little bit of assistance, you can put a little bit of weight on that
Yeah.
knee. Okay, great. So when we're assessing our 6 Ps with our knee injury on Perrin here, so we're going to first assess pain either on palpation or on movement. So we've already had a little bit of a look and a little bit of a palpate on Perrin's knee. So there was localized pain on the medial side of the knee, and there was some pain on movement, obviously, when she's been trying to weight bear since she's had this accident. Pallor, our colour of our knee, other than a slight bit of bruising, is normal, and we have normal capillary refill. Paresthesia. So, Perrin, have you experienced any pins and needles or tingling or anything in your knee or down your leg since you've had this? No, it's all felt pretty normal other than a bit sore. Okay, great. So we've ruled out paresthesia. There's no pins and needles, no tingling sensations, anything like that. So our pulses that we checked earlier were normal. We've got normal distal pulses, pedal pulses, strong and regular. So there's no paralysis either. So like I said before, Perrin has been partially weight bearing, and she is able to partially move the joint. So there's no paresthesia that we need to worry about. And pressure is our 6P for our P's. So we're going to move on to looking with the swelling. So if there's any severe sudden swelling in under 10 minutes in the joint area, it's indicative of hemorrhagosis. Now, if hemorrhagosis is present in the joint, we're not going to move it. So hemorrhagosis may indicate a fracture to the joint surface, a capsule tear, or a cruciate rupture. So because she's been weight bearing, we can probably rule out a fracture and there's no hemorrhagosis. I'm going to go ahead and I'm going to carry out some tests on Perrin's knee. Okay, so my first test I'm going to carry out is just our general appearance check, which we've already done. We also checked our dimple check, so we've got no pitting oedema or anything like that. We're now going to do a patella apprehension test. So, Perrin, does that hurt there at all?
No.
No? It doesn't feel too badly? Okay.
Yeah.
Okay. So, our patella appears to be in place. It moves around on the kneecap nicely. Doesn't appear to be oddly shaped or any localized pain on the patella there. So we're also going to do a patella tap. So I'm just going to tap your kneecap here, and is that okay with you?
Yep.
Okay, now if it really hurts, just let me know, okay?
Okay.
Does that hurt at all?
No.
No?
No.
Okay. So our patella tap's showing up no localized pain again on the patella itself. Okay, so I'm now going to compare Perrin's knee to her uninjured side. So I'm just going to remove the blanket here if that's alright, Perrin, and just have a look at your other knee. We're just going to compare general appearance, compare size, just to see the extent of any swelling that may be present, and compare bruising and colour, etc. to the uninjured side. So I'm also going to do an anterior and posterior cruciate draw sign test on Perrin. So Perrin, for this one, what I want you to do, it's going to be a little bit sore, I'm sorry, so please bear with me. If it's too sore, let me know. So I'm going to pull your knee up just to about there. Is that comfortable for you?
Yeah, that's okay.
Okay, now what I'm going to do is I'm just going to place a little bit of pressure behind your knee here, and I'm just going to try and pull forwards a little bit.
Yeah.
Let me know if it's too sore.
It's not too bad.
Cool. And posterior, I'm just going to push backwards a little bit. Okay, that's great. Okay, now I'm now going to do a locking McMurray's test. So I'm going to keep your knee like that, Perrin. I'm just going to support behind your knee, and I'm going to hold your ankle and just raise your leg up a little bit. Okay, again, just let me know if it's too sore. Okay. I'm just going to twist and rotate and just check the range of movement and the laxity of that knee. Okay, right, we can pop your knee back down now. That's it. Okay, great. Because Perrin's knee is quite sore, a little bit too sore to straighten fully and put too much pressure on, I would usually do a straight leg raise, an extension, but I think in this case it's going to be a little bit too painful for Perrin, so we're not going to do that one. So our Ottawa knee rules acknowledge that it's an acute knee injury with one or more of the following. So age 55 or older, Perrin's only 34 years old. So we've also assessed for tenderness at the head of the fibula. So on our palpation there was no localized tenderness at the head of the fibula. There was also no isolated tenderness of the patella on palpation earlier on. She isn't able to flex her knee to 90 degree, but she is able to flex her knee to some degree. So the fact that she can't flex her knee to 90 degree angle does obviously indicate there is some degree of injury with this knee here. Her ability to bear weight, as mentioned earlier, she can bear weight partially with some assistance, but she cannot fully weight bear on this knee. So, in my opinion, I would put this as potentially a grade 2 endpoint strain. So we've got some swelling, we've got some bruising, we've got some laxity in the joint. But we've got no hemorrhagosis or anything that would indicate a complete tear or rupture of any ligaments in the joint. So our intake of this assessment, some relevant key points that we found during our assessment would be our low blood pressure from sitting to standing, which we found upon taking our full set of vitals with Perrin, which I believe would be indicative of postural hypertension, which would have caused her dizziness and her caused to trip and fall heavily on that right knee here. It was also, we found with our joint assessment, minimal swelling in the knee, which would indicate no hemorrhagosis. We've got some range of motion, which eliminates a fracture, some joint laxity, and some bruising of the joint, which would be indicative of a grade 2 endpoint strain as well. So with Perrin here, I would stabilise her knee, stabilise the joint, make her as comfortable as possible with some pain relief, and transport potentially to the nearest accident and medical clinic.